This lecture will cover the systemic metal exposures in large and small diameter metal-metal total hip replacements. The Metasul metal-metal bearing was introduced as a small diameter total hip replacement nearly 20 years ago. The wear rates from these metal-metal devices were much lower than the conventional metal and poly total hip replacements. A few years later, modern large diameter metal-metal bearings were introduced as hip resurfacings. These worked very well and seemed to bridge the gap for young patients with hip disease and demanding an active lifestyle. One of the advantages of the metal-metal hip resurfacing is the low dislocation rate. As well as a reduced dislocation rate, the large diameter metal-metal total hip also offers the benefit of a low wear and an increased range of motion before impingement. However, this study suggests that small diameter metal-metal total hips produce lower metal ion levels when compared to large diameter metal-metal bearings. We had great doubts about the methodology used in this experiment and decided to initiate our own study. The first group are 28 unilateral large diameter metal-metal total hip replacements. These have an as-cast alloy bearing with a titanium alloy stem and were followed up at 12 months post-op. The second group was 28 patients with a small diameter metal-metal total hip. This was a wrought alloy with a stainless steel stem. Since we had fewer patients with a Metasul total hip replacements than those with large diameter total hip replacements available for the study, the follow-up time period was extended over a wider range for those with the Metasul total hip replacements. Patients with any other metal devices were excluded, and there were no patients with a history of compromised renal function. Systemic exposure was analysed with whole blood samples and urine collections taken at 12 months post-op. These samples were analysed by high-resolution inductively coupled plasma mass spectrometry, which has low reporting limits. The results show that the whole blood cobalt levels are within the same range. The small diameter and the large diameter means, with the 95% confidence levels, show there is no significant difference between these two groups. The whole blood chromium levels also show a similar trend, and there is no significant difference between these two groups. The mean urine output for both groups indicate that there is no significant difference between these two groups for cobalt and chromium urine output. So the difference between the mean whole blood levels in the small and large diameter total hip replacements are not statistically significant. Also, daily urine output for cobalt and chromium in both large and small diameter total hips were also in the same range and without a significant mean difference. Why is this so? Tribological theories suggest that by increasing the bearing diameter, you increase the sliding distance of the surfaces, which in turn enhances the sliding velocity of lubrication fluid, and benefiting from a fluid film between the bearing surfaces, thus reducing the wear. However, when you look at the literature, you get a different impression. This paper indicates that large diameter bearings produce less wear, and their hip simulator study finds a 28 mm bearing produces more wear than a 54 mm bearing. From one study alluded to earlier, this suggests the complete opposite. However, this study has many confounding factors. The limitations to our study is that it is a retrospective study, and there may be variability between the patient groups. It is also a short-term follow-up. We do intend to follow these patients up long-term with metal ion assessments. To conclude, this study shows that there is little difference in systemic exposure between small and large diameter metal-metal total hips in the early years. Thank you.